Hi, Dr. Fiore. So you've just finished our training on motivational techniques to help your patients who smoke but aren't quite ready to quit. So do you feel ready to help those people try and quit?
Sure, I want to get my patients to quit, but I'm an incredibly busy doctor. I have 20 patients coming through every afternoon. I've got to take care of what brought them to the clinic that day.
Yeah, I definitely hear that. You've got people waiting for you and you only have so much time with each patient. So I'm wondering, about how much time do you think you could give to working on the smoking and quitting smoking issue?
Do you know I've got 4 to 5 patients scheduled every hour? I've got to deal with their bronchitis, I've got to deal with their upset stomach, I've got to deal with what brought them to the clinic that day. Sure, we talk about smoking. I could give it a couple seconds, maybe 10, 15, or 20, but I got to take care of what brought them to the clinic that day.
Oh, absolutely. I mean, your patients are there to see you for a reason, and as you and I both know, they're usually not coming in to see you because they want to quit smoking. But they really do have diseases and disorders, you think, that are probably related to their smoking?
Yeah, but you know what? I've already asked them if they want to quit, and they've told me no. That's what our medical assistants do before I even see the patient. And boy, I don't want to get into a back and forth with a patient who doesn't want to talk about this.
Oh, absolutely. You're completely right. You don't want to get into some sort of tug of war, some sort of argument with a patient about wanting to quit. But there are other ways that you can introduce this really important topic. Things like asking permission or just asking one more question to find out more about it. For instance, if you go to your doctor, how would you feel if your doctor said, you know, I just want to ask, would you be willing to tell me more about something? How would that make you feel?
Well, I think if my doctor asked me that, I'd feel as though they were interested in me, maybe respecting where I'm from, as well as accepting that I may not be ready to quit at this moment.
Okay, so maybe if you said you had about 15 seconds max to deal with this, do you think there's something that you could do in 15 seconds that would not only bring up the smoking topic, but also help your patients feel more respected and like you're interested in them?
Well, I think I could probably do what you suggested. I could probably ask them, why is it that you don't want to quit right now?
Okay, so there's definitely something, even though you're incredibly busy and you've got a lot of other things to deal with, there's something that you could do in 15 seconds that could at least start the conversation.
You know, as long as I don't back people up in my waiting room, as long as really responding to what brought the patient to the clinic that day, but I think I probably could at least begin that conversation.
Okay, great. Well, that's the first step. Starting the conversation is what people really need. They need doctors to help them just get started on the road to quitting. So I wish you all the best, and I hope you can do that in your practice.